Queensland health authorities are scrambling to retrace the steps of a cleaner who has tested positive to a new COVID strain from the UK, while an emergency National Cabinet meeting will discuss how to keep that highly contagious variant out of Australia. Let's go live now to our reporters. First to Brittany Lane in Brisbane. Now, Brittany, the worker spent days in the community while infectious.
Well, that's right, and that's why everyone here in Brisbane today is on high alert after the cleaner tested positive to a mutant strain of COVID-19, which has emerged from the UK and is considered up to 70% more contagious. Now, the woman in her 20s had her first shift here at the Hotel Grand Chancellor on January 2nd. However, she didn't develop symptoms until 2 days ago, where she got tested the same day, meaning she was in the community for 5 days infectious. Now, during that time, she visited suburbs like Algester, Calamar Vale, the city and Sunnybank Hills, with a full list of locations on our Facebook page. Now, this is the first time this UK strain of COVID has been reported as a community transition case, and it's why Queensland Health is taking this extremely seriously. They've now locked down hospitals, aged care facilities and disability centres across Brisbane, not wanting to take any risks, and we should be hearing from the Queensland Premier Anastasia Palaszczuk very soon. All right, terrific. Thank you. Political reporter Taylor Aitken is in Canberra. Now, Taylor, how is National Cabinet likely to respond to this new UK strain?
Good morning, Mon. Well, National Cabinet will convene at 10 a.m. this morning to discuss potentially strengthening the COVID-19 protocols for returning travellers. It is understood that masks could be made mandatory for overseas travellers for both domestic and international flights, and passengers from the UK forced to undergo rapid testing. Also on the agenda today, the vaccine rollout plan after the schedule was brought forward to mid-February. Under that plan, 80,000 people a week would be vaccinated, with quarantine and border workers, frontline health staff among the first in line. Next would be adults aged over 70, with Indigenous Australians over 55 and adults with medical conditions. Next would be older Australians, followed by the rest of the adult population, with children the last to be vaccinated. The government looking to overseas examples to help guide Australia's vaccine rollout strategy.
We're talking to Israel today, actually, some very senior officials from there today, because they've been one of the key standout countries about getting large numbers of vaccines out to their population.
Now, the vaccinations would be free and would be administered from thousands of vaccination centres that will be set up right across the country. Mon?
OK, now to Amber Laidler in Sydney. And Amber, the COVID threat on the northern beaches isn't over yet.
Good morning, Mon. Yes, after almost 3 weeks in lockdown and just 2 days away from a possible easing of restrictions, the northern zone of the northern beaches has been dealt a major blow, with a new mystery case emerging in Avalon. This case is a man in his 40s who's actually spent time in isolation, being cleared, but has now sparked these new alerts for the Woolworths and the Chemist Warehouse in Avalon. You can find all of the details on the Sunrise website. This case will be included in today's numbers. Yesterday, New South Wales only cases were returned travellers, and the state government is now focusing on our hotel quarantine program, zeroing in on that as a weak spot in our defence against COVID-19. In December, there were 4 leaks in just 3 weeks. One was a city hotel cleaner infected by an American flight crew here at the Novotel Darling Harbour. A ground transport driver caught COVID after an airport pickup. The Avalon RSL outbreak is linked to a case in hotel quarantine, and a patient transport driver carrying an infected return traveller sparked the Baralla outbreak. The constant breaches have prompted our state government to start testing all international flight crew from next week, and by the end of February, all hotel quarantine staff will be tested every day, Mon.
OK, Nathan Templeton is in Melbourne. And Nathan, there's been a massive testing blitz to get on top of the outbreak there.
Yeah, Mon, it's been an encouraging response from Victorians. Almost 200,000 this year alone have come forward for testing. And yesterday's numbers were very impressive, 33,000 tests with no new cases. But that blitz has put some strain on the system. Dorovich Pathology, which processes about a quarter of the state's swabs, had an IT glitch yesterday, meaning that thousands of people who were waiting on negative results didn't get them. So they've been forced to isolate for longer than than what was necessary. Also this morning, there is a new public exposure site. That's the Zara store at Chadstone Shopping Centre. A positive case went there on Boxing Day. But despite these concerns, there is hope that the border to New South Wales is going to be open sooner than we expected, hopefully as early as next week, which would be excellent news, particularly for those Victorians who have been stranded since that New Year chaos.
Oh, wouldn't that be wonderful? All right, team, thank you all so much.
The government is aiming to have 4 million Australians vaccinated against COVID-19 by the end of March. Joining us with more is Chief Medical Officer Professor Paul Kelly from Canberra. Morning to you. Now let's start with the phases of the immunisation. Talk us through these priority groups.
So it's very important that we get to people that are at the highest risk of being exposed to the virus right now in Australia and those that are more likely to get severe disease. So when you think about that, who are the people at most risk? I'd say it's people working on our borders, in our quarantine system and so forth. So the people that are directly exposed to people coming from overseas. We have a global pandemic going on and that's a priority. But also our healthcare workers, our aged care workers, our disability care workers are likely to be exposed or risk passing the virus on to people that might get more severe disease. Our elderly, people with chronic disease, some disabled people. So they're our absolute priority, those two broad groups.
Professor, isn't it a wonderful thing to be talking about potentially having 4 million Australians vaccinated by the end of March? I mean, if you looked back to a year ago, we would have taken that and then some. What have we learnt from watching the rollout in other countries? Is Australia well prepared?
We are really well prepared. We've had that advantage, unlike the US, the UK, so many other countries that are really grappling with an enormous pandemic right now. I think yesterday was the second highest death toll in the world since the start of the pandemic. We've seen overwhelmed hospitals and so forth all around the world, as well as many, many thousands of cases every day and unfortunately people dying. In Australia, that's a very different picture. That's given us the ability to wait until we get full approval from our regulator, the TGA, and to be absolutely certain about safety. That's the number one priority. But also to learn from other countries about that vaccination rollout. And we absolutely are. We're talking to Israel today, actually, some very senior officials from there today, because they've been one of the key standout countries about getting large numbers of vaccines out to their population.
OK, will it work on this UK strain?
Yes, there's absolutely it will. There's certainly no evidence at the moment that the new UK strain or the one from South Africa and any other strains at the moment are resistant in any way to the vaccine. Of course, that's an emerging science and we'll be watching that very closely. The UK strain is definitely more transmissible. It's able to be passed from one person to the other more effectively than previous strains. But there's no evidence that it causes more severe disease, and there's no evidence that it interferes with the vaccine at this stage.
That is wonderful news, Professor. Good luck with the rollout. Thank you for joining us this morning.
Well, let's get more on this unfolding situation in Brisbane. We're joined now by Sunrise GP Dr Ginny Mansberg. Morning to you. So we've got this 3-day lockdown in Greater Brisbane. Starts 6 p.m. tonight. How effective will that be against this highly infectious UK strain?
Well, hopefully really effective, because we don't know how many other cases there are out there circulating in Brisbane at the moment. Now, we hope there's none others, and it's amazing how many Queenslanders stepped up for testing yesterday, and hopefully we'll get even more today. But until we get them all tested, we just don't know. And if everybody who's out there, we think that 50% of people who catch coronavirus have got it from somebody with no symptoms whatsoever. So that for so long as it's circulating in the community, it becomes exponential and more and more and more people get it. And now's the time to do this. They're absolutely right.
Fascinating. So the situation we have is that this woman, this cleaner, was out and about in the community for 5 days while she was infectious. So that is obviously in and itself very alarming. But authorities there seem reasonably confident that a 3-day lockdown will do the job. It's hard to know that, isn't it, when you don't know yet whether there has been any community transmission?
I think that's just the start of it. Let's see what happens after that, because we all know that if you come back through quarantine, you have to quarantine for 14 days because that's the amount of time that it takes until you're not contagious anymore. So theoretically, if she was only out a few days ago spreading the virus, it would be another 14 days from then until the last people who could have caught it from her would actually show up a positive result.
That's for everyone that's come into contact with her as opposed to Greater Brisbane.
Yeah. So 3 days is not enough to guarantee that it hasn't escaped into the community, no, but it's certainly enough to at least get their bearings on what we're dealing with here.
So Jeanette Young, the Chief Health Officer, is saying, please do what you're told.
Yeah.
Stay home for 3 days and we could avoid an outbreak. Do you think they're just trying to stem it, or do you think there really will be a longer lockdown in Brisbane?
I think we have to wait and see. I think if there are more numbers that become positive in the next few days, I think we can expect a longer lockdown. Yeah.
I think it's tough to answer that question until we know exactly how she got it.
Yeah.
And Anastasia Palaszczuk has admitted herself that there's an investigation still underway. So
We don't know how it got out of, into the Avalon cluster. I mean, I think for so long as we are bringing in people with coronavirus into this country, we cannot guarantee that it's not circulating in the community. We're doing everything that we can, everything that we know works. And as we work out a breach, like the transport workers, we, plug that hole. But we just don't have any way to guarantee that it will never, ever get out into the community unless we literally close the borders full stop, and we can't do that.
No, and a lot of people, we are going to now test, international travellers before they get on the plane. We're testing the flight crew in some states. Maybe that needs to be more. But some people are saying, why are we bringing them into the cities? Why have we got hotels in major cities with international travellers like myself sitting there? I mean, people are...
But the regions are probably not as well equipped to the hospitals in the regions to deal with an outbreak there too. So either way, you're going to struggle.
I don't mean dump them in regional areas, but like we were saying, in the top end, they've had those
They have a lot of Aboriginal Torres Strait Islander people out there who are very vulnerable. I mean, there's no good answer, is there? I think as long as we've got our procedures, and it's worked so well. Queensland's gone 4 months without one case in the community. They've done it really well. New South Wales has done it really well. There's just no foolproof strategy.
This is why we need the vaccine.
It is.
As quickly as we can conceivably get it.
And get as many people taking it. Okay.
Thank you, Jenny.
Thank you.